Community immunity and community freedom has always, when you look at the courts regarding community health, has always trumped personal or your individual freedom.
We are not comfortable with this legislation. This is not okay. We don't want this for our kids. And they still passed the bill.
During the 2019 legislative session, no issue was bigger than vaccines. Engrossed House Bill 1638, passed during the session, removed both the personal and philosophical exemptions for the MMR vaccine. So how did it happen? How did a highly controversial piece of legislation like EHB 1638 pass through the state legislature and get signed into law? We came here to Clark County, site of the recent measles outbreak and ground zero for this legislation, to find out. Now that is our objective, and this is Field Report. December 31st was a day of celebration for a bright new year. However, in the shadow of the start of 2019, a dangerous measles outbreak was born in Washington.
The first case we were aware of was seen at Memorial Urgent Care, an urgent care clinic, on December 31st, and the laboratory results came back on January 3rd.
The January 3rd first official case of the measles in Southwest Washington started a biological domino effect that led to 71 total confirmed cases in Clark County.
I kept in close contact with our public health officials here in Clark County as I left Vancouver to head to Olympia for the legislative session in mid-January. But by late January, it was clear that we had an outbreak on our hands and that there was going to need to be action taken legislatively in order for us to help assist our public health experts in putting the brakes on this outbreak and hopefully preventing future outbreaks.
A public health emergency was declared by Clark County Council Chair Eileen Quiring on January 18th, and just 7 days later, Governor Jay Inslee declared a state of emergency. January 25th was also the first day that House Bill 1638, sponsored by 18th District Republican Representative Paul Harris, began its official ascent towards becoming state law.
I decided I would take a small bite of the apple and take a look at MMR, measles, mumps, and rubella, and see if we couldn't get rid of the personal exemption in our state because we had several cases in my area.
The small bite on the part of Representative Harris, House Bill 1638, did cut out the personal and philosophical exemptions parents may have to the MMR vaccine, but it kept both the medical and religious exemptions intact. The bill further requires the State Department of Health to coordinate with public schools to disseminate vaccination information to students and parents.
With the consent of the House, the rules be suspended. And engrossed House Bill 1638 will be advanced at third reading. Hearing no objection, so ordered.
House Bill 1638 was the source of a great debate on the House floor on March 5th as lawmakers clashed over the need for and potential impact of the legislation.
We need our community immunity to be high. In the states that have passed this, it has raised their community immunity. Clark County, we were at about 75 to 80%. Typically in states that get rid of the personal exemption, it raises between 5 and 8%.
$4 billion as of November 2018, $4 billion have been paid out for vaccine injuries. I don't know, and I outside of the legislature, I'm involved in personal injury cases. I don't know of any other area where that much money has been paid out for injuries from a specific product.
We are now vaccinating up to 1,000 children a week in Clark County. So I would submit that this is actually helping our families to understand how to better protect their children from a disease that is entirely preventable.
The cumulative raw count of adverse effects from measles, mumps, and rubella vaccines alone was 93,929 adverse events, 1,810 disabilities, 6,902 hospitalizations, and 463 deaths.
Welcome to the March 29th Senate Health and Long-Term Care Committee.
Moving on with the lawmaking process, House Bill 1638 produced a spirited, jam-packed public hearing on March 29th, a meeting led by 49th District Democratic Senator Annette Cleveland, chair of the Senate Health and Long-Term Care Committee.
In 1951, there were 530,118 confirmed measles exposures nationwide, and 683 Americans died from measles. They didn't just get sick, they didn't just get a rash, they didn't just perhaps incur a lifelong disability, they died.
I am concerned with this piece of legislation, knowing that there are 14 states with an outbreak right now, that 9 of them meet the true letter of this law. So I don't really understand how this is going to fix anything when this exemption has failed in 9 other states to do what people say it will do.
We need to think about, I guess, really what America's about. It's not always about me. It's not always about I hope sometimes we think about those that can't get vaccinated.
The rate of exemptions in our state is low. Mandating this vaccine will not protect public health. I implore you to vote no on passing HB 1638.
It is science and truth that will keep us healthy rather than fear.
Following a few months of passionate legislative debate, engrossed House Bill 1638 was officially signed into state law in a ceremony at City Hall in Vancouver, less than 2 miles from the site of the first reported measles case that sparked the outbreak.
The vocal and visible debate will help Washingtonians and ultimately Americans understand the true science of this matter.
As Governor Inslee said, there has been a vocal and visible debate over vaccines and engrossed House Bill 1638. We now take a look from lawmakers and stakeholders at what issues caused such a disagreement on one of the most controversial pieces of legislation in 2019. The largest looming issue related to the vaccine bill is the elimination of the personal and philosophical exemptions for the MMR vaccine, with supporters saying the sacrifice of freedom is necessary.
I think whenever, and I think the big pushback was, and it always is, Paul, that's my freedom. You're taking away some personal freedom from me. And in a sense I am, but also remember that the courts have weighed in. What about the freedom of my community to move about, to feel safe? And so community immunity and community freedom has always, when you look at the courts regarding community health, has always trumped personal or your individual freedom.
And I hear a lot of the argument from the vaccine proponents, well, this is a personal liberty issue. We shouldn't have to give our child a vaccine. Nobody can force us or mandate the vaccine. I see this as a public safety issue. If I have a child who's has an immune disorder or who has, on cancer chemotherapy, I want to be some assurance that if I send them to school, they're going to be in a safe place and not at risk of having a horrible complication.
I believe as a part of living in a society, while personal choice is extremely important and being able to make decisions that are best for you and your family is something that we should value highly. When it comes to that personal choice then posing a threat to a great many others, then we have to look at implementing policies that best protect the majority.
On the other side of the issue, there are opponents calling foul on the removal of parental rights.
The idea that anyone is doing this simply because the law allows them to, and that if you get rid of the philosophical exemption, they're going to go, oops, shucks, they caught me. I was only doing that because I didn't want to have to go get the shots. I guess now I'll do that. Those people don't exist. So you have you have to have some planning. What are these people supposed to do about their education now? And if you have to come up with some other plan. You just can't simply say, if you want to go to school, then you have to get the shots. That's not good public policy, good public planning.
Many, many parents are concerned that taking away personal and philosophical exemptions is really removing their right to decide what is the best health care or health decision for their own child. I also heard from citizens that may not necessarily be parents, but were concerned that this was a step in the direction of removing freedoms from their right to decide what's right, not only for a child and their child's decision making ability, but their own bodies. And they saw it as government infringing on their rights.
I believe in the vaccination. I believe in the actual benefits of the community vaccinating. What I struggled with and what I just couldn't vote for is the fact that we were taking away that parental responsibility, that ability for parents to choose whether or not something gets injected into their children.
All right, sweetie, Mom's gonna hold your hands real tight for me.
The question of vaccination safety is also one that has been a major point of contention in Washington, both during the legislative process for engrossed House Bill 1638 and beyond.
I worked hard this session to ensure, and I do with all policies that I work on, that we're addressing issues from the standpoint of fact and what the science tells us, what the data tells us, and that's exactly the way I work to approach this issue as well. And I absolutely respect people's personal opinions and personal beliefs. However, personal opinion is no substitute for expertise, and passion's no substitute for knowledge.
The vaccine is incredibly safe. It is one of the most effective vaccines that we have, and it's inexpensive, especially with the Vaccine for Children program. The risk of a severe reaction is extremely, extremely remote, and certainly far less than the risk from the disease itself.
The measles-containing vaccines have listed on their package insert that they will place 1 in 1,250 to 1 in 3,500 children in the ER. And that's not as an individual, that's your risk, but over the population, that's a rate. Now we know that 80,000 kids are getting their first MMR or MMRV every year, and that means we're putting 100-ish kids into the hospital.
Once I started doing more research on my own and looking into some of the adverse effects that the VAERS system reports, certainly, some of the data that's out there. National, Vaccine Injury Court has been implemented in 1986. So we can't ignore those realities and then try to just force a parent to take a step they may feel is not the best interest of their child.
Has she received a blood transfusion or blood products in the last year?
The systems of vaccination measurement have also played a role in the vaccination legislation debate. Essentially, state officials have said that 78% of school children in Clark County are vaccinated with the MMR vaccine. That percentage comes from the Immunization Information System, or IIS. Another system of vaccine measurement, the Certificate of Immunization System, or CIS, is a form parents fill out to indicate their children's vaccinations. The target immunity rate for measles to achieve community or herd immunity is 95%. The repeated figure has been 78% from the IIS and 92.3% or more from the CIS, thus different numbers in an ongoing debate.
The Department of Health, Secretary Weissman, and also Clark County public health official Dr. Alan Melnick actually kept using the statistic of 78% immunization here in Clark County for students. In my floor speech, I actually quoted a 93.2% CIS, or Certificate of Immunization, statistic. So that data comes directly from the school districts. It's accurate. And so for Department of Health at that time, during the bill hearings, during testimonies, not to be using that data, and that 93.2% is for sixth graders, and that was in Clark County as of November 2018. That is very misleading on Department of Health and the Clark County public health officials' side. They were not quoting something accurate when it was available.
For further explanation about the IIS and CIS systems, TVW went to the State Department of Health.
The Immunization Information System is our statewide immunization registry. It's a database for authorized users like healthcare providers and school nurses, pharmacists, that really records immunizations that people have been given across the state. So the Certificate of Immunization Status form is a form that families need to fill out to document their child's immunization records and turn into schools and child cares to show which of the required immunizations their children have. A parent can also take the hard copy form that maybe they've printed off online or they get from their school nurse and write in their child's immunization history onto that form. Hopefully that's coming from a medical record that they've gotten from a provider or not, but we don't know for sure because parents still can fill that data out themselves and we don't know if it's medically verified data.
Roberts also addressed the concern about the IIS being a voluntary system that parents opt into.
What's confusing, I think, and why there may be a conclusion drawn that the information is voluntary is that on the Certificate of Immunization Status form, there is a box that parents need to sign that says if there's a dose of vaccine on this form that wasn't already there, I'm giving the school permission to add it to the system. So that's not how parents, it's not opting into the system, it's just opting to have the schools enter data that may be missing. And the reason why that's needed is because schools have a whole other set of privacy laws they have to abide through called FERPA, and any data schools get if they're from a parent, if they're going to do anything else with them, it really requires parent permission.
We leave off with lawmakers and stakeholders looking ahead to the future now that vaccination legislation has been signed into law.
I think I'm going to wait and see what transpires in our state. I'm not going to run and do another bill, I don't think. I think we need to wait. Let's see what happens to vaccination rates in the state of Washington. And the goal is to get more people vaccinated. That's the goal.
I'm optimistic. It's going to take a while, but I'm optimistic that we get vaccination rates up. The closer we get to that 95% level, the better I'm going to feel.
Some of the personal exemptions that we still have they might morph into the religious exemption.
Well, I do think there's a reality that parents will pull their children from public schools. They will pull those children and they will probably either homeschool or put them in a private school.
It's clear to me that this debate is one that will continue. Won't be something that goes away anytime soon.